Hi guys, I wanted to pop on and talk to you about a multiple baseline design. Now, although experimental design has a lot of different components, with my experience, I think the best way to really master experimental design is to break it down into each design, get familiar with that design, become friends with that design, and then you can learn all the advantages, disadvantages, and compare the different experimental designs. So today I want to talk to you about multiple baseline design. This is the most widely used design in ABA. It's highly flexible. You can use a multiple baseline design across behaviors, subjects, and settings. Now, often you will see, if you're looking at a visual analysis, that it's in a staggered, stepwise fashion, where you'll see the first baseline and intervention, then the second underneath that, and then the third underneath that. Now, keep in mind with a multiple baseline design, the functional relation requires a change in behavior with the onset of the intervention. So you can't visually see the functional relationship, but there is one there. When you're using a multiple baseline design, you do not withdraw the IV. Now, there is an ethical consideration. When it's unethical or impractical to use a reversal design, you would use a multiple baseline design. So there are two types of multiple baseline design. You have a multiple probe and a delayed multiple baseline design. For your multiple probe, it is a weaker variation of your full-scale multiple baseline design, used to assess generalization and skill acquisition. So keep that in mind, that's super important. You use this procedure when a full-scale multiple baseline is unnecessary, unavailable, too costly, or impractical. Probes provide the basis for determining if the behavior change has occurred prior to intervention. Now, when you use your delayed multiple baseline design, this is also a weaker variation of the multiple baseline design. Initial baseline and IV begin, and subsequent baselines are added in a delayed or staggered manner. So this is effective when a reversal design is not possible, you have limited resources to prevent a full-scale multiple baseline design, or when a new behavior, setting, or subject becomes available. Now, the way you would identify your multiple probe design is that you would literally see probes. So probes are those circles that are not connected. So you would be probing, and that is assessing generalization and skill acquisition. With your delayed multiple baseline, you would see the first baseline starts at the initial point, and all subsequent baselines are delayed after that. So we have some advantages and disadvantages of a multiple baseline design. Advantages: successful intervention does not have to be removed, evaluates generalization, and is fairly easy to implement. Disadvantages: your functional relationship is not directly shown. Information regarding the function of target behavior is not depicted. IV may be delayed for certain behavior settings or subjects, and it does take a lot of time and resources to implement a full multiple baseline design. So remember, guys, the takeaway is that you want to get familiar with a multiple baseline design, then you want to move into advantages and disadvantages. Now remember, the most widely used experimental design in ABA is your multiple baseline design, more specifically multiple baseline across subjects.